the Equipoise partial denture. For those of you who know about this and have heard about it, I apologise for repeating myself. As I said at the beginning, I want you to look at things differently. I want you to see this as though it was your mother, your father that you're doing this work for. And if you're going to give them a partial denture, you don't want them complaining they can't eat dinner, or that their denture falls out when they're out meeting friends and they're socially embarrassed. You want something that's going to work for them. Before I explain how it's done, let me show you a case to hopefully get your attention. A challenging case in anybody's book. High smile line, periodontal involvement, and the teeth that are okay are in the wrong place. Lower arch is, we've got a short dental arch down here. That's what I mean by short dental arch. We've got 5 to 5, kind of stable. I'm not that worried about this. This could be wear from the porcelain work. This tooth here is going to have to come out. So we know that this tooth here is going to have to go. It's loose. This one's periodontally involved as well. This one's in the wrong blooming place. Solid canine, but it's in the wrong place aesthetically. What can we do about that? And as I said before, not all cases can be treated with implants. If I was doing this with implants, I'd take all the teeth out and I'd move all the bone up. It used to be a heinous thing to do, consider losing bone, but here we'd actually start taking all the bone away in order to move the bone beyond the lip line, so again make something that looks aesthetic. But I don't have to do that with the denture. So what I would do, we're general practitioners, we know how to do all sorts of dentistry. Why do we do it all at the same time? It's to the benefit of the patient. So book a long appointment. Bring the patient in, cut the teeth off that you want to hang on to as overdenture abutments, root treatment there and then, or stabilize them if you haven't got enough time for the root treatments, and then take the teeth out that you want to take out. And then, just as I showed you before, fit your immediate denture, because you've liaised with your technician and told them what you're trying to create. And just as before, I'm going to reline the inside of that to make sure it's a nice snug fit and it fits over those front teeth as an overdenture. So there's not going to be any rubbing, there's not going to be any pain after this. It's a nice appointment for the patient. She's improved her aesthetics instantly in one appointment. So how am I going to design this denture? I've got premolars and a molar and ropial big amalgams, and I'm going to crown them all. Literature says I should. I'm sorry, but most patients are not up for that, especially if you've got a compromised situation that's been perio around. So what I'm going to do is I'm going to design a denture slightly different from the way we normally do it. A lot of people here will design their dentures. Some people won't design them. Some will send them off like an acrylic. You might take a better impression. It might be a silicone, but you'll send it off and you'll say, chrome denture, please. And let the technician design it. I know that because I talk to technicians and that's what they tell us happens. In this situation, you do have to design it. And you'll see there are some pretty big gaps appearing here. There's a big space appeared here. There's a big space appeared here, courtesy of my high speed. And then I've cut some pretty meaty res seeds. Let's see what happens with that. This is the denture that we produce. We'll try it in as an overdenture. Check it from the front. Use the res seeds in those spaces to show you. And the other side. I alluded to the artistic nature of denture design. Don't you just love the deep purple periodontal pocketing? This patient wanted something very natural. She was very, very embarrassed about her teeth. She did not want straight white teeth because she knew that would draw even more attention to her mouth. She wanted something that people wouldn't know as a denture. That's us in place. You keep the character of the teeth, but change the colouring and positioning. And this is what we get. So the Equipoise design, that was a metal-based denture with clasps, but you couldn't see them. It locks into place, and the patient can eat an apple with that, I guarantee you. Okay. More importantly, the day I fit that, she needs a friend to help her get it out, because these are so retentive. So it's a very interesting design. Benefits? It's tooth supported, so function's improved. It's aesthetic, no visible clasping. It's extremely retentive, and it's going to retain that retention. She'll come back in a year, it's still going to be retentive because of those guide planes. This is something that I think we all avoid. We have periodontally involved patients. We would like to splint those teeth together, but we don't want to invest in the cost of doing a probe when we know we're going to have to do it again in a year when they lose another tooth. we can use this as a periodontal splint, and we can design it in such a way that if they lose teeth in the future, we can continue to add to it. Because we know which teeth are going to be there for the long haul. And we can use the other ones knowing that they're going to be expendable in the future. You can design something like this, with no joke, so that one tooth will hold the whole denture in place. So it can be done. Not how you'd want to design it, but if you get to that point, that's the end game. It means that denture may have lasted them 10 years. Very few patients, unfortunately, are treated properly for periodontal disease. So we might send the hygienist every 3 months. Sadly, that's not actually treatment. It's not going to work unless they have the actual proper help to remove the disease process. But this, combined with 3-month periodontal appointments to the hygienist, might keep that dentition going for many more years. But most importantly, they've got quality of life that they would not have had with a partial denture. They can eat things they couldn't have eaten before. The tip of this instrument is for measuring your rest seats, because that rest seat's 1.5 millimeters deep. Significant. Take a model just to show you, that's how you measure it. The other end of the instrument is to get the space between the teeth. They have to be 1 millimeter. These guide planes have to be 1 millimeter thick. But how do you parallel them up? That's this instrument. You can take it all around the mouth and use it to parallel up these guide planes. And that's what you end up producing. How the heck do you design these things? Is it just come out of the ether? Is it on a whim? Reassuringly, there's only 16 designs and they cover every aspect, every tooth loss possibility. And that comes with the book. I'll take an example to show you really where you can take this to. This lady here, class 2, we can't turn her into class 1. She's got micrognathy, her lower lip, her lower jaw is so much smaller than her upper. Here it doesn't look so bad, but the true reality of the problem becomes exposed there, where all her lower teeth are sitting inside her uppers. Her problem was that every tooth in her upper jaw was sore. And she blamed the partial denture, because it was the usual. I got a denture, then I got another tooth, then I got another tooth. It must be the denture's problem. So we had to do a bit of tidying up. I had to take some teeth out, I had to tidy up some fillings. But the design that I decided to come up with was something that was going to lock all the teeth together, as I've shown you the example, but give her all her occlusion on the denture. So I wanted to splint every tooth together as if you were doing a roundhouse bridge, but without the expense. And this is what we came up with. The way this is designed is, I've done it such that there's a plate all the way down here. So if any one of these teeth is lost, I can add to it. This denture would work the way I've designed it, with just that tooth there, and just that tooth there. It'll still work. So I'm planning for potential tooth loss. I don't think she's going to have much tooth loss now, because the whole thing is stable. Once you stabilize things, it lasts longer. That's it tried in. That's the spitting, and that's its in position. With the staining as well, so you pull the rest of it together as well. So it's really putting everything together. Now, how you doing, man? You got 5 minutes? If anybody else hasn't got 5 minutes, exit stage right. This is pulling the last thing, just pulling the whole lot together and saying, where can you take all this? We've got a vertical dimension problem. These are patients you see in the practice every day, where people have been, your colleagues have been treating these patients for years before you, and now they come to you and they say, listen, I've had this denture, I've got the crowns, I want to improve my life, what can we do about the appearance? And you can't do an awful lot because the occlusion isn't helping you, the appearance isn't helping you. It's like, where do we start? So this is advanced prosthodontics using removable dentures. So the very first thing I would do, and the problem I find when you're doing crowns and dentures at the same time, and anybody here who's done it will realise that it works some of the time. When it does, you're a hero, but when it doesn't, it costs you an arm and a leg and you wish you'd never done it. And the reason it doesn't work is because you've lost control somewhere down the line. Because by and large, the same technician isn't doing the crowns that's doing the denture. And you've lost the aesthetic goal. The aesthetic goal is being lost somewhere in the mix of the crowns being made or the denture being made. And you need to get control of that at the beginning. And that's your job, it's not the technician's job. That was the revelation to me. It's not find one technician to do it all. It's take control over what you're trying to do. So what I would do first of all is do a wax up. You could do the wax up chair side if you're that way inclined, you want to be artistic about it, or you get the technicians to do it. So it's just a wax setup. Ignore the lower teeth. I'm not interested in the occlusion. The patient's coming because she wants the aesthetic, so let's give her an aesthetic situation she likes, bring the teeth together as I've done in the lower, and see where the problems are. Because that's when the problems can be highlighted. You can't tell the problems from before. We've got an idea, but they're not really there. Now they're there, because that's what she wants, she likes, and that's what we have to achieve. So now I've done that, I'll have that converted into a denture, into a provisional. I'll then prep the teeth, and as you can see from the lower photographs, I'll use that provisional denture as my guide for prepping the teeth, which is where I'm keeping control. And at the end of this appointment, we'll let me take the impressions, I'll then, furthermore, I'll keep the denture in place and take my working impression through the denture. But then you say, well, that denture's not going to fit. But then I'll use my Tokiyama rebate and I'll make it all fit again, so it all comes together. And you can see, we make that fit very nicely. There's a gap there, but comes together. Technicians will then produce these crowns, and they build these lock-in rest seats, these really, really meaty lock-in rest seats. We'll come back, I'll fit the crowns, it looks just like temporaries. We've got control of the aesthetics. Denture goes back in, it drops out as quickly as it goes back in, so I'm going to use that material I showed you before, the Tokiyama, and I'm going to lock it together. So now she's got the crowns in place, she's got denture in place, the aesthetics are good from day one, the patient is on side all the way through. Now I'll take my working impression for the chrome. I know books and courses will tell you that you should be fitting everything at the same time, the chrome and the crowns. Personally, I find that there's a potential to lose control at that point. I like to know things are fitting a little bit ahead of time, rather than everything coming as a surprise at the end. Christmas comes but once a year. We design the denture, and it's all kind of plain sailing from this point, isn't it? We check it fits, nothing unusual. That's where we were. That's where we ended up. Increased the vertical. Change the situation. I've got a little bit of a clasp down the bottom corner here, but it's not a clasp that anybody's going to know. Public out there don't think of that as a clasp. If they did, I can take a sandblaster. And you sandblast that, they don't see it. Because it doesn't shine out, it just looks like filling. And there we go. Warning. This stuff is attractive but not easy. Like everything that you've learned is a practical skill, and you're going to find that if you want to do this, it is going to take a bit of time to gain the skills and to gain the knowledge. And you're going to find the first few cases, as they were with me, they're going to be cases where you're doing it, it's your hobby, it's your interest. Hopefully at some point dentistry has been that way for all of us, and it can be again if you see exactly where you can go with it. And you can treat cases like that. You've got understanding principles, there's no reason not to do it, and to learn. Because while you might do it just for one case, it gives you vast amounts of knowledge and information and a toolbox of things to do for cases that come up in the future. But if you do it and your chrome doesn't fit, something doesn't work out, don't blame me, okay? What I would say is if you're going to do it, why did you call me? Because the way we've set the practice up is we want to be approachable. And we're more than happy for anybody to give us a call or email us and ask us what they're doing. It doesn't just have to be implants. You know, it can be crown Bridgework, it can be dentures like this, it could be lab work. If you're having a problem with the case, by all means just ask us. What we've done is we've set the situation up where we have, as I said, specialists in every area and the laboratory. And teledentist at Edinburgh Dentist is an email address for us that you can contact us with any question at all. This all gets directed to our mobile phones. iPhones are ubiquitous now, aren't they? So if you've got a problem with a case, you're sure about something, take a photograph with your iPhone or your BlackBerry and email it to us, and you'll find within 24, 48 hours we'll get back to you. Okay. Thank you very much.